Mm, mm, mm. Doctors and hospitals are billing patients on Medicaid, committing fraud, scam. What? I'm about to show you what's really going on. Hello, everyone. Thank you for stopping by to see me today. Thanks so very much. Today I have, let me be sure now. Let me be sure. 5 videos to show you about hospitals and doctors and care facilities who are abusing Medicaid. And do you think they just abusing Medicaid? Most likely, too, they are abusing medical insurance as well. Getting over on the patients, getting over on the taxpayers, because our taxes pay for Medicaid. Getting over. They don't care about you. They just want the money. The money. That's all they care about. When y'all see these videos, you're going to be pissed. And this should somehow let you know from now on, moving forward, that you should check your medical bill. Because you just might have something on your bill that you did not receive. Okay? And you're going to see also, and you're going to wonder why the medical staff went along with this. There is no way in the hell, if I worked at a hospital or a doctor's office, that I'm going to be in the scam with them. I am going to quit. I'm going to quit. All right, y'all, let me pull this up. Make sure you go over there today and watch my new cooking video. Blueberry cheesecake cookies. Take a look. It's a test kitchen, all right? I'm going to be testing recipes. If you want me to test your recipe, go to my cooking channel, Cooking with Sandfay, okay? Go on over there. Let me try your recipe too, or try mine, all right? That's all I got to say about that. Moving right along. Let me pull up this first one. TikToker shares hospital charges after being admitted for 3 days for leg surgery. This video went viral, y'all. Viral.
I just got my hospital bill. I was in there for 3 days for a leg surgery, and I'm going to read you the itemized charge list. First, semi-private room and bed changes, $12,487. Changes for drugs and IV solutions, $2,222. Medical surgical supplies, $2,918. Clinical laboratory changes, $5,314. Operating room charges, $7,749. Anesthesia services, $2,157. Physical therapy, $874. I literally had no physical therapy. I had surgery and I walked with a nurse when I got out. And I was the one who said I wanted to walk on my own. I literally held some random nurse's arm. Emergency room services, $5,615. Recovery room services, $1,948. For a total of a whopping $41,288. Free that boy.
What? She had leg surgery. Then she discovered, because she was smart enough to read her bill, they said she had physical therapy, but she did not receive any physical therapy. And her total bill was $41,288. Damn, that's expensive. Damn! You think she got $41,288? Well, Medicaid paid for it. She's on Medicaid. How many of y'all on Medicaid? Do you have to come out of your pocket for anything? I don't know, because I'm not on Medicaid. I don't know how it works. Put it on down there and let me know. Okay? Does Medicare pay 100% for a surgery? 100%? Well, this video went viral, y'all, because people are outraged because I'm pretty sure they have experienced the same thing. From their doctors, from the hospital, charges. And you be like, I don't remember nothing like that. I mean, when I had a baby, they said I had something I can't remember. Like, I did not have that. I don't know why they have that on my bill. Why? Do they give Medicaid patients a bill? Do they give you a bill before you leave the hospital, or do they mail you one? Put it on down there, because I want to know. Let's move to the next lady. That was cold-blooded right there. Now, this lady right here, she's going to tell you how she got caught and evicted for Medicare fraud. She worked for a facility, and everybody in the facility, I guess, had to know what was going on. Listen to what she said right here. She's talking about the lady that I just played, but she's going to tell you how she went to jail, how it impacted her.
Physical therapy, $874. I literally had no physical therapy.
This right here is exactly how I got convicted for Medicaid fraud and then 22 months in federal prison. When I saw this video, I was like, this is exactly what happened to me, or how it happened. A lot of times people think when I say that I went to prison for Medicaid fraud, they think that I had Medicaid fraud or was like getting Medicaid and doing something with it. I'm not quite sure, but it was actually what she's talking about. Ask yourself, when was the last time you went to the doctor and actually read your remittance advice that comes in the mail after you've been to the doctor? Now, this may differ if you are a person that pays for your insurance, but a lot of times people who do not pay for insurance, like individuals on Medicaid, they never really look at it because they know it's not a bill because they're getting free health care. And individuals like myself, who at that time had permission to bill the insurance company on your behalf for the services that were provided, can put extra billing codes or codes that you possibly never even received on your service and bill for it. And just as easy as you see with this hospital, and I'm not saying that's what they did, I'm just using this as an example, you can easily rack up $40,000 over a period of time in my sector of Medicaid claims. And that's what happened to us. Long story short, people always ask me how we got caught. It was someone who read their remittance advice and realized that their child had not received the services that the agency that I was working for billed Medicaid for. And this is so embarrassing to admit, but it's the truth. And if I'm going to tell the truth, tell the whole truth. Not only did the child not receive the services, for the time period that it was actually billed to the insurance, the child was deceased. Yeah, double whammy, real fucked up, right? We passed that, but word to the wise, don't commit fraud, number one. Two, always check your remittance advice sheets that you get if you go to a hospital, a doctor office, or whatever on your insurance.
The child died, and they sent a bill. I don't know if that was before, the child died. Maybe the child died and the bill was already in process. You know what I'm trying to say. So she went to prison for Medicaid fraud for 22 months. Why did she go to prison if she's not the doctor? Okay. Because maybe she is the one that's doing the paperwork. So you guilty too, because you're doing the paperwork. You know if a person, had the treatment or not. But you still gonna go along with the doctor or the hospital, whatever it was, the care facility. You still gonna go along with it. So you're going to jail too. You are going to jail because you are a part of the scam. Do you hear me? Nurses, RNs, CNAs, LPNs, do you hear me? You going to jail too because you know that the person did not receive what they saying that they received on the bill. You know it's a lie, but you keep on doing it. Well, we don't see the bill. We don't. Maybe some of y'all don't. Maybe some of y'all are innocent. But they ain't looking at that, okay? When the federal government comes in, they looking at everybody involved. So that's why she went to prison. Okay. Next video, child. Lord have mercy. It says a psychiatrist held patients against their will in an inpatient facility so he could fraudulently bill Medicaid at the highest rate, Arkansas investigators said. The highest rate. That's just like kidnapping somebody. Watch.
Allegedly, a psychiatrist held patients against their will in an inpatient facility so he could fraudulently bill Medicaid at the highest rate. I think this is so disgusting. If this is true, this is disgusting. Could you imagine being a person going through something and your psychiatrist puts you in a facility against your will just so that he can reap monetary gain from that? That is disgusting. That is abuse of your license, is abuse of authority if this comes out to be true, but only time will tell. But this is a hot mess.
So I thought family member or someone, let's say it's your elderly father. You know he's mental, you know he's crazy, you know he be doing stuff he ain't got no business doing. I thought a family member had to admit the person. So you trying to tell me a doctor can admit a patient without the family consent? So basically they can do anything just to get the money. That's what they doing now. Y'all, this been going on for a long time. This ain't just start happening. It's been going on way back when. 20 years, 30 years, probably 50 years. It's been going on ever since Medicaid has come into play. Well, they do it to insurance companies too, but we're talking about Medicaid today. Look at this right here. Texas couple allegedly scams Medicaid out of $14 million by fixing the same wheelchairs hundreds of times. The same damn wheelchair. We gotta keep on fixing it. Don't get them a new one. Don't get them a new one. We'll keep on fixing the same damn wheelchair. Here we go.
Listen to how this couple scammed Medicaid for $14 million. So Jeremiah and Maria have a scooter repair business with 37 clients, okay? 37 clients. And from 2019 to 2023, they were billing Medicaid to repair their clients' electric wheelchairs, okay? Something like this. They had 37 clients and over 4 years gained $14 million. How? Well, they were rebilling for the same parts over and over again for the same chairs. Sometimes around $760,000 per chair, with one chair having over 300 some claims on it. The best part is some of their clients couldn't even get out of bed to get in their chair. Okay, so they're repairing a chair that just sat in the corner, wasn't even used. And I guess Medicaid was just like, hey, sounds good. Here's the check. Thanks for fixing it. Listen to who they have after them right now. The FBI, the Department of Health and Human Services, Office of Inspector General, Texas Health and Human Services, Texas Attorney General, Medicaid Fraud Control Unit, the Texas Department of Insurance, and the Assistant U.S. Attorney. If convicted, they could each face up to 10 years in prison for healthcare fraud and money laundering, and a mandatory 2 years for each count of aggravated identity theft. This took 4 years to catch. 4 years and $14 million repairing 37 chairs. How did no one find this sooner?
If this ain't the biggest scam ever, I know someone with a wheelchair on Medicaid too. They had to keep fixing her chair. She weighed about, ooh, Lord, probably 500 pounds. Yeah, they got wheelchairs like that, you know, the motor ones. She can't walk. They kept fixing that thing, kept breaking down. I don't know if because, you know, she was too big for the chair. I have no idea. But it kept breaking down. She keeps saying, Medicaid's going to fix my chair. They're going to fix my chair. But she said they keep billing Medicaid and they ain't fixed the chair. So I'm telling you, y'all, it's bad out here. It's bad. Okay, but I want to tell y'all this. This video right here. Before telling it on somebody, let me pull it up first. Before you risk of reporting Medicare fraud without an attorney, be sure that you know what you are talking about. Be sure that you are not going to be implemented in the crime because you knew about it from way back when, for months, for weeks, for years. You knew about it, but you didn't do nothing. But all of a sudden, you get mad at the doctor because he done pissed you off. You get mad at the administrator, the head nurse. You get mad. And all of a sudden, you want to report it, but you knew about it. So you are part of the problem. You are. Listen right here.
Certain things you need to think through. Number one, do you have any exposure? Medicare fraud, Medicaid fraud, PPP loan fraud, pharmaceutical fraud, customs fraud, they all may carry criminal consequence. And if you're part of the scheme, you also may have some criminal culpability. And through the False Claims Act, the mechanism that generally addresses fraud against the government when a private person reports it, they consider two things. First of all, they consider the criminal side of it, and then the civil side.
And they're going to consider if you were involved too, just like I said. Y'all, there's a lot of waste within our government. Fraud and scams. There's a lot. Can't catch them all. You're not going to catch them all. You're just not going to be able to do it. So I want you to go down in that comment section and let me know, do you know anyone who's frauding the government? Who's committing Medicaid fraud, insurance fraud, welfare fraud, food stamp fraud? Do you know anyone like that? Have you ever reported anybody for doing such a thing? Or you just don't want to get involved because you just might be scared they might retaliate against you. Oh yeah, that's why a lot of people don't report, because they don't want to have no problems because they just might find out. But they're not supposed to tell who told them, but they might know. Once you go to court, they're going to know who told it on them. That's why a lot of people don't get involved. All right? Thank you. With all that being said, make sure you like, share, comment, and subscribe. And watch the next video coming up. Thank you.
Yeah.